Let's bring in now Dr. Monica Gandhi. She specializes in infectious disease. She's a professor of medicine at the University of California, San Francisco, and she has helped us navigate our way through the pandemic. Nice to see you again. So let's start with China's zero tolerance policy. You know, the country has had these draconian lockdowns, but the World Health Organization says that has slowed the spread. But now we're seeing new outbreaks there, and that's prompting more lockdowns. What do we take from all of this?
You know, the zero COVID policies that China has tried for 2 years are just not going to work. And it's not because they haven't tried hard enough, because I don't think anyone's tried hard enough like China has. It's because this is a virus that cannot be eradicated. It's not humans' fault. It's the virus's fault. It has found in many animals. It's really transmissible. There are variants that keep on coming. And really what we have to do is vaccinate, especially those who are older. Hong Kong is another very good example where they didn't vaccinate as much as they should in those over 60 because they were like, oh, we're COVID zero and that's okay. Now they're causing, there's so many hospitalizations. We need to vaccinate older people and boost them to keep the population most safe from mortality from COVID.
And one of the interesting statistics I was reading about this latest outbreak in China is out of 3,500 new cases yesterday in Shanghai, only 50 of them were symptomatic. So should we be scared or relieved by that?
Well, you're right. It's a great question that there is this asymptomatic, there's always been this attempt that if you don't have symptoms but have it in your nose, are you passing it on? Actually, some very good contact tracing studies over the last 2 years have shown us that if you don't have symptoms, your rate of passing it on is much, much lower than symptomatic. So if we start focusing on people who have symptoms, try to protect everyone with that incredible vaccine that protects them from severe disease, which is what we care about most, instead of all these strategies that China are using that have not gotten them to the end game that many places in Europe, the US, the UK are trying to get to, which is just living with endemic COVID.
And when we talk about Europe, throughout the pandemic, we've generally been about 4 to 6 weeks behind Europe in infections, right? Their numbers are also going up. What should we expect here in the States?
Yes, so it's true that BA.2 is more transmissible than BA.1. And so everyone's like, are we going to start seeing increased cases here? Though we've had BA.2 now almost 40% of our new infections, we're still not seeing too much increased cases here. We could dodge it like Denmark did, that has high levels of vaccination. And also importantly, they had a lot of BA.1 in their country like we did. So a lot of us were infected, which protects us from BA.2. So it remains to be seen. What's the most important thing is that anyone who's older should be boosted. And then we're going to start talking about fourth boosters too.
Right. And every state now has dropped their mask mandates. Winter is over, not in Chicago, but in most of the country. What is your advice to patients when they ask you about what precautions they should be taking?
So anyone older should be vaccinated and boosted. All of us should be vaccinated. And I hope that the boosting, because we only have 40% of our population boosted, really is most needed for those over 60. And we saw that with a third dose in Denmark, UK, Israel. So please get your booster if you're older. Then how else to protect yourself? If you want no exposure to a virus at all, we do have good one-way masks, and those are N95s and KN95s, FFP2s, KF94s, or double masks. It is true that mask mandates have been dropped. That's because we're all at different rates of vulnerability to the infection. Also because the hospitalizations have gone down, which is the CDC metric. And finally, because some people, wanted to go on a hospitalization metric, which I agreed with, and it's been a controversial measure. But anyone can protect themselves by wearing their own safe, fit and filter mask. One-way masking works.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.